Accanto allo storico impegno nelle neuroscienze, Biogen da qualche anno ha affiancato quello nelle malattie rare e più di recente quello in immunologia. Ed è proprio di quest'ultimo settore che parliamo con Daniel Quirk, a capo della direzione medica global di Biogen, per farci spiegare quali sono i farmaci più interessanti della immunologia attualmente in sviluppo e più in generale qual è la strategia dell'azienda. Daniel, could you please outline the current strategy for Biogen portfolio development?
Yeah, so Biogen overall has been on a journey to transform their company to have sustainable long-term growth. And a big part of that has been transforming our pipeline. And just recently, over the past couple of years, we've launched 4 new assets with new mechanisms of action. We have lecanemab for Alzheimer's disease. We have omaveloxolone for Friedreich's ataxia, tofersen for SOD1 ALS, and zuranolone for postpartum depression. But in order to sustain ourselves going forward, we realize that we can't just be reliant on a neuroscience portfolio. As you know, neuroscience portfolio carries a lot of risk. The evolution of those diseases have endpoints that take time to hit. And oftentimes you have to start a long phase 3 trial before you've been able to have a proof of concept. So therefore it becomes really important that we actually adjusted our portfolio to include other disease areas, most notably immunology, so that we could have a much better balance of risk and that we could discharge some of that risk by having positive proof of concept. In addition to immunology, we also have a clear focus on rare disease.
Daniel, which is the link between your neurology expertise and immunology development, immunology involvement?
Sure. Well, first, there's a good reason why we're extending into immunology as well. If you look at our portfolio, heavily based in neuroscience, we have expertise in MS, in Alzheimer's, Parkinson's disease, postpartum depression, as I mentioned, as well as a number of other diseases such as ALS, SMA, Friedreich's ataxia, which are more rare disease, right? And also in those rare neurologic disease, we've also recently entered into a collaboration with Stoke Pharmaceuticals to treat Dravet syndrome. So those are 2 areas of key expertise. Immunology makes sense for 2 key reasons. Number one, we are leaders in immunology and have been as a result of the immune basis of MS. For decades, we have been involved in the importance of the immunologic aspect and how that relates to MS. In addition, we've also had an asset, litifilimab, that we've also developed in-house. So we have that internal expertise. In addition, we have expertise in rare disease as well, and you'll hear in a minute why that's important with regard to the assets that we have.
Which are the most important diseases in immunology in which your research is involved and the products in a more advanced stage of development?
Sure. So we're very excited about 3 key assets. So if we start with litifilimab, which is an anti-blood dendritic cell antigen 2 antibody, that has significant promise, and we have phase 3 studies ongoing in SLE, systemic lupus, as well as cutaneous lupus. If approved, this would be the first drug approved for cutaneous lupus. There's currently significant unmet need, and there are no approved therapies. We also believe that this mechanism of action is very unique and will offer significant advances for patients with systemic lupus. Our second asset is in collaboration with UCB. That's also for systemic lupus. That's an anti-CD40 ligand antibody. So if you look at lupus overall, it affects about 5 million patients worldwide. So again, significant unmet need. The third asset is felzartamab. Felzartamab came to us through the acquisition of HiBio. This is an anti-CD38 antibody. Anti-CD38 is very important because it's expressed on plasmablasts as well as plasma cells. These are the antibody-generating factories in our bodies. So any antibody-driven disease, there should be evidence of efficacy. This extends across neurology, across nephrology, hematology, dermatology, and rheumatology. The areas that we're focused on initially are 3 in nephrology. Antibody-mediated rejection, for which there is currently no approved therapy. The second is IgA nephropathy, for which we have a very differential effect in that we can lead to long, durable remissions, so that patients can actually be treated for only 5 months and then stay off of therapy for up to 2 years. And then the third is primary membranous nephropathy, the leading cause of nephrotic syndrome in adults. So very excited about those, and they're all in phase 3 currently. Additionally, we're studying it currently in a phase 1 for lupus nephritis.
Daniel, you mentioned the challenges for the involvement in neurology. Which are those for the development of products in the immunology area?
Yeah, I think there are challenges overall with the evolution of our pipeline and the focus in neuroscience, rare disease, and now immunology, focusing both in lupus as well as in nephrology. It's really important that we maintain focus and that we be very disciplined. And the company has done a great job being stewards of our resources to make sure that we can fully execute. So that's number one. Specifically with regard to immunology, as I said, although we have internal expertise and deep knowledge of neuroscience, it's really important that we're able to convey that to the external community and that we engage with the right key opinion leaders, and we also are able to execute these trials in appropriate fashion. That will be critical for success. And we're already off to a great start. In Europe, for instance, they started a One Step Ahead program for educating internal colleagues, as well as making sure the external community knows about our strength and what we bring to immunology.
Daniel, do you believe that the current expansion of Biogen in immunology has rebalanced the overall pipeline of your company?
Yes, I think it does so in a couple of ways. First, it complements our current presence in neuroscience as well as rare disease by now adding immunology. Second is many of these acquisitions lead to late-stage studies. So we now have multiple phase 3 studies as a result. We have the IgAN study, we have the antibody-mediated rejection study, we have a PMN study, and then we also have studies in SLE as well as CLE. And now with the acquisition, it's not in immunology, but it speaks to how some of our recent acquisitions help. Our partnership with Stoke Pharmaceutical helps also bring in another future phase 3 study with zervanersen.
So it's a new Biogen coming soon.
It's a new Biogen coming soon, but I think the other part that's also important to note is that our current pipeline is advancing and advancing rapidly. We presented data today at Cure SMA on salanersen, which is the interim analysis on some phase 1 data for SMA, which is very impactful. It actually shows improvement in slowing neurodegeneration and also helping those patients who were previously treated with gene therapy also achieve now new milestones after they received salanersen. So we're very excited about how our portfolio is advancing across the board, not just in immunology.